many occasions, the magnificent response of the British public to the government's request to comply with social distancing instructions has meant that we have begun to get on top of this virus. We've seen the transmission rate, the reproduction rate fall to below 1, and that means that the number of new infections is falling within our communities. And that has meant that pressure has been kept off the NHS. The NHS has responded magnificently to make sure that patients have always had available the treatment they require. Over time, this also has an impact on the unfortunate number of deaths that we've seen. And as we move to the next phase of managing COVID-19, I think first thing I'd like to do is to remind everybody of the 5 tests that the government has set for adjusting the current lockdown. The first I've already referred to, and that's that the NHS continues to have sufficient capacity to provide the critical care requirements that are needed, but also specialist treatment right across the UK. Secondly, it's that sustained and consistent fall in daily deaths from coronavirus, and we are beginning to see that, but we need to make sure that that is maintained. Thirdly, it's reliable data to show that the rate of infection is decreasing to manageable levels across the board. And again, as I've said, it's everybody's efforts in complying with social distancing that means that infections have fallen and will continue to fall. Fourthly, this has been a challenge, not just in the UK, but globally, around the operational response to a pandemic. That includes PPE, it includes other things. And moving forward, we need to ensure that those challenges, testing is one of them, are in hand, and that we are in a good position going forward to meet future demand. And finally, and critically, that any adjustments going forward don't risk a second wave, a second peak of infections that again runs a risk of overwhelming our health systems. So those are the 5 key tests that have been set, and the government will be looking to be confident that it has met those before it moves to the next phase of the lockdown and the measures that we will need to take going forward to stay on top of this virus and ensure infection rates remain low. Now, in the next slide, I'm providing some details of exactly how the British public have complied. And the first is an example on how people have been approaching contact, particularly with vulnerable people, over a period in the middle part of April, showing that 84%, the great majority of adults, have said they'd either not left their home or only left their home for permitted reasons, and 87% of adults avoiding contact with older or vulnerable people. So again, great testament to the efforts that the British public have gone to ensure that we reduce infections. And then on the right of this slide, some information on the number of people who've been working at home since social distancing measures were introduced. And that's 45% of adults in employment saying that they work at home, and that compares to around 12% of last year. So again, a great increase in those that are not going out, that are staying at home and are managing to work without having to go in their usual place of work. And on the third slide, we begin to see the testing information. The Secretary of State said, as both Secretary of State and John have said, the number of tests have increased dramatically. But it's not just the fact the numbers have increased, it's the fact that capacity has increased so that we can use testing for a far wider range of purposes. And you have already heard some of the areas in which that is going to be critical going forward in the months ahead. In the fourth slide, we show the new cases as determined by positive tests. You will see that that has increased a bit in recent days, but that should be seen in the context that we have increased the number of tests in the round. So more testing and more testing of different groups of individuals is likely to bring more positive tests as a result. But overall, I think the number is relatively stable, and that is a good sign and reflects that the level of infection is falling. In the next slide, we then move to people who unfortunately, and again, it's a mild illness for the great majority of people, but for a proportion who do have to be admitted to hospital, you can see that since the middle of April, numbers of people in hospital with COVID-19 have been falling. And that's particularly marked in London, that was ahead in terms of the infection rate, and therefore that fall has come quickest in London. It is starting to move down, maybe at a slower level in other regions of the UK, but nevertheless, overall, the trend is downwards. And then that also translates in the next slide to people who, again, small minority but important group that have to be treated in our critical care facilities. This shows the proportion of people with COVID-19 in critical care beds, and again, that is falling in the 4 nations. And the absolute number of people in critical care beds, so not just the percentage, but the absolute number, is also declining. And then finally, we move, unfortunately, to deaths, the sad deaths that have occurred. And again, we're now showing deaths in all settings. We were previously, up until a few days ago, showing deaths in hospital settings. We've now expanded this. And again, you see those numbers do vary from day to day, and there's a reporting lag at the weekend. But overall, the 7-day rolling average, which smooths out those that daily variation, is showing that the number of deaths is beginning to trend downwards. And then very finally, we show the usual international comparison against other countries. And again, this comes with the usual caveat that this sort of comparison is really important. It's now UK all settings, but the real comparison is in all-cause mortality, so in excess deaths in countries. That is measured more consistently between countries, but there will be some time before that analysis can be done. So although it's important to show this data, I think it's important to remember that it will be a number of months and perhaps longer before we can see the true comparison between countries. So finally, to remind people that the hardships we've been going through, the compliance with social distancing is working. The key thing is it needs to continue to work, so we all must continue to not think that this is over. This is really the beginning, but it is translating into benefits in pressure on the NHS and on reduction in deaths. So it's important that we all keep it up. Thank you.
Thanks very much, Steve. So the first question is going to be from Andrew from Leeds, who joins us by video.